Thank you. No, I think this has been a very helpful hearing. Let me, again, first go to, because people have to move on in other meetings, and I think everybody's been very good. I think the witnesses have been extraordinary. Let me recognize the ranking member for if you have any further questions or closing. If you can just do your closing as well. There you go.
I'm going to do my closing with a question. Closing with a question. First of all, I want to thank our witnesses again. You are so, obviously, so competent and professional. It's just been an absolute pleasure to have you here today. And I want to thank Mr. Chair for this, bringing this hearing and bringing these witnesses. Exceptional. And I just, you know, I don't mean I don't like to exaggerate or be trite, but I do think that what we listened to today is earth-shattering. It really is, because there are millions of people whose lives are at stake. We're on the, you know, the real possibility of losing opportunities with Africa, the fastest growing population in the world, opportunities in regards to security and trade. But we also heard that we are on the brink of finding a way to keep people from ever having their HIV come back with a simple injection every few months. These are, I mean, that's just absolutely amazing. But here's what you both said. I think, and that's why I want to end with the, listen, before I end with the question, I have to take one more pot shot, okay?
Go.
Just one more. He understands me well. Listen, I just want to say this. A violation of the Helms Amendment, which affected 21 patients, I'm not going to minimize your shock. I wouldn't bring smelling salts with me in the future, but it's not an excuse to put 20 million lives in jeopardy right now. It's not an excuse. We're going to move on, and we're going to try to do this the right way. But I think what both of you have said, as I've heard you, is this, and you can correct me. Let's not shatter, let's not lose what we have had with PEPFAR. Let's find a way to transition to where other health systems in other countries can take over, where this can be a sustainable program, which will mean really the United States, being our taxpayers, to be able to use their money in different ways. But maybe what we're going to be in other ways to stop other calamities. This is my last question that I want to make sure that I can, from both of you. Do you both agree that it is very important that we do not let Humpty Dumpty on the ground, all shattered before we try to make this transition, that we have to make sure there's prevention, that the whole comprehensive PEPFAR piece is looked at before we're able to even transition? I think that I'm trying to say that as diplomatically as I can, and that does mean that other agencies, that we have to make sure that CDC, USAID, well, we don't have USAID, but the pieces of USAID, the Defense Department, the Global Fund, that those pieces are working too. Did I make my question clear here? I
think so. I'm happy to go first. You know, I would hope, Ranking Member Frankel, that your taxpayers and your constituents were proud of PEPFAR. You know, I would hope that they would see the work that's been done and really consider it an American success story, not just an African success story. You know, it has been very personal, I think, to many Americans who are knowledgeable about the program, that we've been able to save so many millions of lives. And one of the things I've reflected on is sort of, you know, in the polling that's done that shows that Americans really like this, you know, I think it resonates because it's some of the values that they see in their own communities, that we don't let families suffer unnecessarily, that Americans are uniquely built to tackle big problems. And this is a big problem that Americans have tackled, and I think they should be really proud of that. So as we look ahead, we shouldn't forget those values and why that's so important. And again, I think Ambassador Dybel and I are aligned in many ways that, we do need to think of a transition and sustainability plan, but first we have to look at the capacities that are there, and really reassess what are those capacities we have, what are the strengths of American ingenuity and American companies that we really want to bring to bear. I think we have to look at sort of the goals we still want to achieve. PEPFAR's mission has been very clear. It has been meant to save lives, reduce infections, put people on treatment, and stop people from dying, especially children dying of AIDS. Are those still the goals? And then you can look at a sustainability plan on a country by country basis and say, here's where we can move, here are the roles and responsibilities we're going to share, here are the roles and responsibilities that have moved on to you, here's where private sector can leverage this work and really help us bring those innovations like digital health, like AI, like those new prevention technologies to bear. It's a longer conversation. I don't think it's just a U.S. policy talking to the national government's discussion. I do think you need all the partners at the table to really go through it and assign those roles and really think to the future. Because I don't think we want to arbitrarily pick a timeline and, as you said, sort of waste all the infrastructure, waste all the work we've done because we decided that we wanted to be out by a certain day and all those reasons we were doing this work no longer mattered.
Mr. Dybel.
Thank you to this subcommittee and to the chair and ranking member and to the whole committee for holding this hearing, first of all, because there are so many other things to do, and for your constant bipartisan support. I do think you framed it exactly right. We have the opportunity to have not only the legacy of the last 20 years, but a tremendous diplomatic, national security, and economic success. So we do want to transition from financing over time, but we want to transition to stronger economic, national security, diplomatic partners. And that we can do. It will be different country by country. There are some countries that will require long-term support because of their socioeconomic status. Others can move more rapidly. And I would like to emphasize again that if we move too quickly, the groups most likely to be impacted are faith and community-based organizations because governments don't actually have mechanisms to fund them. But we know, because we've done it in the past, we can support them to create those mechanisms. So we have an opportunity before us, similar to 25 years ago when PEPFAR was started. We have an opportunity to have a massive win for the United States on all levels by having successful transitions, by working with the countries. And I can guarantee you that the countries want that transition, but it has to be done in a staged, structured way rather than a chaotic, rapid retreat.
Thank you. And I'm not asking another question, but I'm just waiting for the... Again, thank you both. Mr. Chair, I just have a request, if I don't know what to call this, from this committee. This is, a lot of people, I think what we heard today is so important. I hope that we can find some consensus to deliver a message. I'm not a political message. We have got to keep PEPFAR stabilized, keep the component parts together now so that we can do this transition, because you cannot transition from nothing or from a mess. It'll cost a lot more money. So I hope that we can find some way to deliver this message that I think I've gotten from these two witnesses today in a very non-political way, and then move towards the transition that we've heard about. And with that, I yield back.
Thank you very much.